Colorectal cancer is the third most common cancer diagnosed in the U.S., excluding skin cancers, and it's the third deadliest. The disease impacts families every day in every part of the country, and it's increasing in incidence among young adults younger than 50. But fortunately, colorectal cancer is often preventable and highly treatable when caught early. Joining me today, Dr. Liana Tsikitis, Fellow of the American College of Surgeons, and we're going to talk today about why screening for colorectal cancer is vital and why all adults, including those under 50, need to remain vigilant about screening. Welcome.
Thank you for having me, Audrey.
Thank you for joining me. Who's at risk for developing colorectal cancer?
So everyone is at risk of developing colorectal cancer. We have about 6% lifetime risk for developing colorectal cancer. Certain persons, of course, that have family history, they have a higher risk for developing colorectal cancer, or persons that have genetic syndromes that predispose to colorectal cancer.
How does it develop?
So every growth starts with few cells, and they grow to form first a precancerous growth, a polyp, we say, an adenoma that easily can be removed with colonoscopy. So our screening test can remove it before it becomes a cancer. And then when it's not attended, that growth is going to grow within itself, and a lot of cancerous cells will be developed and eventually can grow to close the pipe, the large intestine, to obstruct, or to go to, the cells may migrate to other organs like the liver and the lung when it gets to advanced stages.
And what are some of the signs and symptoms of colorectal cancer?
The early stages of colorectal cancer or the polyps are not symptomatic. They don't cause any symptoms. That's why it's extremely important to get screened when it's indicated. When it's more advanced, we start seeing changes in bowel habits, that they're persistent and consistent. We see rectal bleeding. Certain patients complain of unintentional weight loss and abdominal pain.
So checking with your doctor is going to be important, and getting screened is also important. What are the screening guidelines?
So the screening guidelines actually recently changed to start screening at age 45. We are seeing an early onset. We're seeing colorectal cancer in the young. And unfortunately, the young are the ones also that come with advanced stages. So the screening guidelines changed to start at age 45. But I want really to alert everyone, if there are symptoms like the ones I mentioned, to definitely be brought up with their primary care provider and seek the next steps.
Doctor, why do you think colorectal cancer is being diagnosed in younger people? Is it our diet? I mean, what's going on?
It's a great question, Audrey. We really don't know. We do believe that diet may play a role, but it may not be just diet. Environmental agents. Overall, there are some changes that we see. A lot of people believe that it can be behavioral habits as well. It's very hard to really say what exactly it is, but definitely it's real. We're seeing it every day.
Well, we've talked about who should be screened and at what point. Let's talk now about some of the screening options that are available. Everyone knows and has heard about the colonoscopy, but it seems like people maybe aren't going to get a colonoscopy because they're afraid.
Yeah, and what you're saying, it's very true. So we have few options for screening. We have stool tests, and within the stool test, there are two of them that are commonly used. One is the FIT test that checks the hemoglobin of the individual, the blood count in a way, in the stool of that particular person. And then we have another stool test that can test tumor cells if there is a tumor in the person, as well as their hemoglobin. Both are pretty sensitive. The FIT test is about 80% sensitive to pick up, cancers. The colonoscopy is the gold standard. There is under the endoscopy umbrella, we have also flexible sigmoidoscopy, which it's a shorter, in a way, colonoscopy. One could think that we are only examining the left side of the large intestine. When my patients say I'm very fearful to undergo colonoscopy, As a physician, I find that it's my duty, my role, in to delineate why they are fearful and try to reassure them. Some may be the prep, and there are many preps now in the market that we can make it more palatable for our patients. And some is maybe the actual procedure and why they're fearful. Like, so with moderate sedation, the procedure is very safe, and most importantly, saves lives. And it's the best screening tool we have right now. So again, delineating where the fear is coming from and having that discussion with your patient, I think, is necessary when that fear arises.
And do you think that people are embarrassed? I mean, after all, it's pretty personal.
Yeah, no, absolutely. Definitely a little bit of taboo issue, not a dinner conversation, as I say, but it's part of our body. And the fact that we can catch it early, I think the embarrassment, I understand it, but I think through a talk with the patient, maybe it can be reassured and it can be alleviated. So that's how I usually approach it. You're right, embarrassment. I really applaud all celebrities that have gone on screen saying that they're getting their colonoscopy and normalizing it, because it is part of our body.
Indeed, it is. And if you want to be healthy, well, you got to do what you got to do in order to be healthy and to find out if you're healthy. And that means getting checked. What advice, doctor, would you give to someone who's reluctant to get screened?
Well, first I would start with the fact that we can quote the rates of cure when you catch a polyp and you get the polyp out, you have prevented a possibility of that polyp becoming a cancer. So it's the best news. But when you catch it early, like early stages of colon cancer with surgery alone, you can have a cure rate over 90%. And then on the other hand, survival and prognosis with advanced stages is not as great. So that is one, I think, argument. Again, if they are reluctant, delineating why they're reluctant, the prep, I may, work with them in figuring out what the best bowel preparation would be to have a successful endoscopic exam. A lot of patients will complain about that. And then the actual procedure, I go over with the procedure and with the patient beforehand. Try to make it easier for them, understanding of what they're going to, what the screening would be, what it will be entailing.
And how often are the screenings recommended? Is this something yearly, every other year? What's the timeline?
Yeah, Audrey, it depends on the screening test that we order. So with colonoscopy, if we find no polyps, then we'll say 10 years interval. It's the best news. A lot of the patients give me the thumbs up after a colonoscopy. Oh, no polyps, 10 years. But with the stool tests, the FIT test will be a yearly exam. The other stool test that I mentioned that also test the tumor cells, if there are tumor cells, it's every 3 years. So it does depend on the screening modality that the physician has ordered. Again, it's a discussion between patient and physician of what the best test may be for that particular person.
As always, be sure to speak with your doctor or your healthcare provider about what's best for you in your circumstances. Where can we go, Dr. Tsikitis, for more information?
So for more information, definitely first the primary care office is, I think, the best way to get all the information one may need. But if they happen not to have a primary care provider and they want to learn more, I mean, going through the internet, you can go through the guidelines from professional surgical societies. You can go, or even like typing screening guidelines for colorectal cancer, CDC guidelines will come up. A lot of other guidelines will come up and people will be able to find. But I always urge everyone to have this discussion with their primary care provider.
Screening for colorectal cancer is vital, and all adults, including those under 50, need to remain vigilant about screening. Dr. Liana Tsikitis, Fellow of the American College of Surgeons, has been my guest. Thank you so much for joining me.
Thank you for having me, Audrey.